The next award to be presented is the 2026 Henry Cade Memorial Award. The recipient of this honor is Frances Gail Bormel, who is receiving this award for supporting the goals and objectives of NABP and the state boards of pharmacy to protect public health. Gail retired as the director of FDA's Office of Compounding Quality and Compliance, Center for Drug Evaluation and Research in January 2026. She has more than 25 years of regulatory, legal, and pharmacy experience and has guided national drug quality, compounding oversight, and compliance strategy. Gail also has a proven record of building and leading high-performing organizations, shaping federal policy, directing major enforcement programs, and advising top government leadership. In addition, she has deep expertise in compounding, issues related to unapproved drugs, over-the-counter and import-export regulation, and federal and state pharmacy law. During her tenure at FDA, Bormel held several additional leadership roles, including Director of the Division of Prescription Drugs, Senior Policy Advisor for the Office of Unapproved Drugs and Labeling Compliance, Associate Director for Policy for the Office of Unapproved Drugs and Labeling Compliance, Associate Director for the Division of New Drugs and Labeling Compliance, and Regulatory Counsel for the Office of Compliance. Prior to joining FDA, Gail was an associate legal counsel for the United States Pharmacopoeia, an associate at Hyman, Phelps, and McNamara PC, and assistant director of the Drug Control Program for the Massachusetts Department of Public Health. Gail, will you please join me on stage?
I want to thank you so much for this honor. I'm deeply moved, and I want to sincerely thank NABP, thank you, Al, and NABP, and the Executive Committee for this award. To be recognized by you is truly humbling and a great honor. My career has spanned really about 40 years in pharmacy. I spent 35 of those years working in public health and public safety, whether in federal, state, or local government, at USP, or behind the counter as a pharmacist. Throughout this journey, it's been my distinct privilege to support the NABP and our state boards of pharmacy. In fact, it has been one of the highlights of my career. Pharmacy has afforded me a profession and a professional life that's more exciting than I could have imagined. I've seen this world through the lens of retail, industry, and nonprofit organizations, as well as through my work as a state regulator and through 22 years as a regulator with the FDA. But when I look back, the best part of the job hasn't only been the policy and the mission to protect public health, it's been the people I've worked with. While the mission to protect public health is what brought us all together, the relationships we've built have been meaningful and enabled us to achieve so much more than any of us could have imagined and could have managed alone. I have been very lucky to work at jobs I love, supported by people who have challenged me to be better and hopefully to have made a difference. I'd like to thank my family who have been very supportive of my work. A big thank you to my husband, Joe, and my children, Kate and Alex, and both Joe and my husband, Alex, are here today, so it makes it very special for me. I also want to recognize my work family. The accomplishments during my career are not mine alone. They belong to the outstanding professionals I have worked with. Several of these outstanding people have helped me make a profound difference in my regulatory career, including at FDA, the USP, and the Department of Public Health. And they include Kathy Anderson, Elisa Bernstein, Don Ashley, and Mike Levy at FDA, Joe Valentino and Jennifer Devine at USP, and at the Massachusetts Department of Public Health, Kathy Keogh, Nancy Ridley, and Chuck Young and Donna Horn, who are at the Massachusetts Board of Pharmacy. Thank you for your mentorship and partnership. Together, we worked on very important initiatives, including implementing Sections 503A and 503B of the Act, COVID-19 flexibilities, implementation of a prescription monitoring program, the drug formulary in Massachusetts, inspections, monographs, and a myriad of outreach and education to stakeholders. As I look forward to the future, I see pharmacy continue to be at the front of the evolution of healthcare. This makes me realize just how fortunate I am to have chosen pharmacy as my profession. It continues to give me a front row seat to an essential part of healthcare. State regulators are the heartbeat of this profession. It has been my privilege to assist the state boards of pharmacy. You are always at the cusp of important decisions affecting this profession, and I believe this will continue. It's not an easy role, but as we navigate the changing landscape, your role is vital and makes a difference in public health. I hope to continue supporting the pharmacy profession and the important work done by NABP and the state regulators. Thank you again for this incredible honor. It's been a privilege to work with you all.